The dramatic rise in cancer diagnoses among people under the age of 50 is no longer an anomaly or statistical fluke. It is a deeply unsettling trend that signals a larger and more complex public health crisis brewing beneath the surface of modern life. The latest study, published in Cancer Discovery, provides perhaps the most comprehensive and alarming look yet at early-onset cancer, revealing a spike in breast, colorectal, kidney, and uterine cancers so steep that it demands immediate attention from both medical professionals and policymakers. Between 2010 and 2019, these four cancers alone accounted for an 80% increase in cases in younger adults, and the reasons, though still under investigation, are far from comforting. What's most disturbing is that this surge is affecting people during their prime years: adolescents, young professionals, and parents of small children, individuals who, just a few decades ago, would rarely be considered at risk. The data show that about 63% of these early-onset cancer cases are occurring in women, signaling a gendered dimension to the crisis that complicates matters even further. While improved detection and adjusted screening guidelines are capturing more diagnoses earlier, this cannot fully explain away the scale of the increase. Early detection may be part of the story, but not the whole story, and certainly not the most troubling part. Colorectal, uterine, and testicular cancers, in particular, are not only appearing more frequently in younger adults, but are also contributing to rising mortality rates. This is especially alarming because these are cancers that, when caught early, are generally considered treatable. That death rates are still increasing implies either late-stage diagnoses or cancers that are behaving more aggressively in younger bodies. This reality adds a grim dimension to the rise. Not only are more young people getting cancer, but some are dying from it, despite medical advances and heightened awareness. What are the culprits? One of the leading suspects is the unchecked rise in obesity, which has become a defining feature of American public health decline. It's not just about weight. It's about the systemic inflammation, insulin resistance, and hormonal imbalances that accompany it. Obesity is not a superficial lifestyle choice. It is a deeply rooted consequence of a society built on sedentary behavior, ultra-processed food, environmental toxins, and relentless stress. These factors create a biological environment ripe for cancer development, especially in younger bodies that are exposed to them earlier and for longer periods than in any previous generation. Moreover, shifts in reproductive patterns, delayed childbirth, fewer pregnancies, and less breastfeeding may be playing a role, particularly in the rise of breast and uterine cancers. These are not mere lifestyle decisions, but reflections of broader economic and cultural shifts that have altered the trajectory of women's health. In this light, the surge in cancers among women isn't just a medical issue. It's a reflection of how modern life is reshaping biology in unintended and dangerous ways. Another factor, often overlooked but deeply implicated, is the toxic load of modern environments. From endocrine-disrupting chemicals in plastics to carcinogens in food, water, and air, young people today are living in a chemical soup. Benzene exposure, for instance, linked to leukemia, is now tied to common household appliances. These are exposures that accumulate silently, often beginning in childhood, and by the time cancer is diagnosed in adulthood, the trail of causation is nearly impossible to trace. But that does not mean it isn't real. It simply reflects how deeply embedded carcinogenic risk has become in our everyday environments. Even global studies are echoing this trend. A 2023 international report found early-onset cancer cases worldwide jumped nearly 80% between 1990 and 2019. And far from being evenly distributed, North America now stands out as having one of the highest rates of early-onset cancers. The shared characteristics of nations leading in this trend, high consumption of red meat, processed foods, alcohol, sedentary lifestyles, and chronic stress, offer no mystery. They paint a picture of societies that have traded short-term convenience and industrial efficiency for long-term health disaster. Worse yet, there remains significant confusion and lack of clarity around how to act. Screening guidelines are being revised, but often reactively. While colorectal screening age was recently lowered to 45, what about the growing number of diagnoses in people in their 30s? Or even 20s. How do you screen for uterine or kidney cancer in young adults with no symptoms and no family history? The medical establishment is not equipped for this shift. Young people with unexplained symptoms are often dismissed, misdiagnosed, or forced to wait months for specialist care. The system still assumes cancer is a disease of aging, and it is failing to catch up with the reality. This lag in response reflects a broader institutional inertia that pervades much of the healthcare industry. While data pours in, action is slow. Funding for research into early-onset cancers remains limited. Public awareness campaigns focus on traditional risk groups, and worst of all, too many in power still view these trends as outliers or statistical noise rather than the canary in the coal mine that they are. If this trend continues unchecked, the societal costs, both human and economic, will be staggering. In the final analysis, the rise in early-onset cancer is a warning. It is not merely about more cases or different age groups. It is a reflection of how our collective way of living, our food systems, our chemical exposures, our healthcare infrastructure, and our cultural assumptions about health is producing a new generation of cancer patients at younger and younger ages. Until we confront the structural drivers of disease, these numbers will only continue to climb. We are not just witnessing a shift in epidemiology. We are living through a slow-motion catastrophe, and time is running out to respond.